Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today is the first Saturday of the month, which means it's time to debut a brand new show on Chef AJ Live called Overcoming Autoimmune Disease with Dr. Melissa Modala and Dr. Micah Yu. Please welcome them both to the show. It's very nice to see you again.
Hi, Chef AJ. It's wonderful seeing you as always, good friend of ours.
I love it that we
Yes.
get it with you guys. We get a twofer.
Yeah, that's
Yeah,
right.
yeah. It's fun. It's funner that way.
We could have gotten two shows, but no, we have a couple of husbands and wives. Melissa and Nate do a show together. It's wonderful. So I'm so happy to have you both because I love your area of expertise and that you're doing it plant-based.
Yes, we're
Awesome.
we're so fortunate to be able to serve the community and serve the plant-based community as well. So we're excited to be on your show.
I can't wait. Anything new or exciting in your lives?
Yeah, well, new year, new you. Why you? We're really focusing on autoimmune disease because that's where we see our world is shifting of the rise in this pandemic and post-COVID. So we have a lot of projects coming up, some, YouTube.
YouTube, you have a YouTube cooking channel.
That's
I have
right.
my YouTube autoimmune channel now, starting a podcast soon. So a lot of cool things coming up.
Very cool. Yeah. Why is there such an increase in autoimmune disease, you think?
Yeah, I think well, talking about food, that's number one. Food is more, there's more preservatives, it's more inflammatory, more GMOs, all these different things are in the food, more toxins, more stress on Earth, more viruses. Um, it's a lot of factors that add up together to produce autoimmune disease. And it's so unfortunate that this is happening, but this is a reality of our world now, including COVID-19, and that hasn't helped either, which is
Oh,
why we're talking about
no.
it today.
So people are actually developing autoimmune diseases after they have COVID. Is
You
that
can,
correct?
yes,
Yeah.
we see in our clinic.
Wow. And where do you guys practice?
Yeah, we practice in Newport Beach, California, but we see patients throughout the world and especially in different states in the US as well.
Wow. Well, that's a nice area, Newport Beach.
Yes.
Yeah, it's nice and sunny, and we see people in different time zones, and it's just nice connecting our world because unfortunately it's a global issue. But we also love connecting, just like you. You're using technology; it's on our side.
Yeah. Do you ever take the ferry over to Balboa Island?
We
Yeah,
we
we
took a
drive there.
we took a Duffy boat just this past weekend. It was really nice.
I
The
re
ferry was right in that intersection that we were at.
I just remember as a young child doing that and remembering it was really fun.
Yeah, it's so beautiful.
Very
Just getting
relaxing.
some sun and water. Can't
Just
complain.
don't remind me because look at how I'm dressed. I lived in Southern California for the first 62 years of my life, and now I'm in Northern California, which has a lot of wonderful things about it, but the weather isn't one of them.
Yeah, all the fog out there, I'm
Yes.
sure.
It's been like a Noah's Ark here. It just must have rained for felt like 40 days and 40 nights, but it's probably been about a week. But anyway, this too shall pass.
Right. We're looking forward to having some, summertime, but it's one of those things where we keep our spark through you. In the community, we gotta find something to smile about.
So what are you guys going to talk about today?
So we are talking about long COVID-19. So long haul COVID.
That's a bad one for people to get. I've known some people, friends and relatives, and they suffer tremendously.
Yeah,
Yeah.
it can be difficult to treat, conventional medicine doesn't have too many answers right now, but we do have some options for patients that we're going to talk about today.
Well, I can't wait because that'll help a lot of people. It's just, you never know who's going to get it long and who's not. You just hope
hmm
it's not you.
Yeah, exactly.
Yeah, well,
So,
love to see your slides.
yeah, let's begin. So let me pull up our slides. Okay, so I am Dr. Micah Yu. I'm a rheumatologist, and this is Dr. Melissa Mandala. She's a family medicine and psychiatry specialist. And just to let you all know that this presentation is for educational purposes only. If there are any questions about treatments, please discuss this with your medical practitioner. So this is my background. I'm triple board certified in internal medicine, rheumatology, and lifestyle medicine. I also graduated from the Andrew Weil Integrative Medicine Fellowship at the University of Arizona. I'm also certified in functional medicine through the Institute of Functional Medicine as well. And I'm one of the co-founders of Dr. Lifestyle, which is our clinic here in Newport Beach. And this is Dr. Melissa Modala, and she's board certified in family and lifestyle medicine. She completed her primary care psychiatry fellowship as well. She's a participant in the Integrative Psychiatry Institute, and she's a lifestyle medicine intensivist and former board member of the American College of Lifestyle Medicine. And she is my co-founder of Dr. Lifestyle. If you guys want to learn more about us on social media or find us in our clinic, my handle is MyAutoimmuneMD. I'm on Instagram, YouTube, TikTok, and Facebook. And Melissa's is Dr. Melissa's Kitchen on Instagram, YouTube, TikTok, and Facebook. And if you want to make an appointment with us, see in our clinic or through telemedicine, it's the link below. It's drlifestyle.org, drlifestyle.org. What are our objectives of today's talk? Well, first of all, we're going to talk about the post-COVID-19 epidemiology, like how common it is, where are we seeing it. Then we're going to talk about some of the pathology of post-COVID-19 and what are the potential therapies out there. There's no FDA-approved therapies right now, but we can talk about some integrative treatments. We can talk about COVID-19 depression and also how COVID-19 is linked to autoimmune disease. And just to give you more insight into our background, we did live through the pandemic, just like a lot of you have, but we did work inside the hospital in the very beginning when everyone was very, very scared of COVID-19. We didn't know what it was. So back in like early 2020, we were both in the hospital. I was in training in rheumatology. Melissa was working as an attending, and we all masked up. We wore our gowns, and we didn't know what it was about, but luckily we survived it, and we're still able to take care of our patients up till today.
Yeah, so basically what Micah was saying is we definitely lived through it. We've seen how it was in the ICUs and the urgent cares and even in our own clinic. So we've seen how it come full circle, and now it's a bit calmer, but it's still very present, especially the post-COVID effects. So right now, to date, we see that basically the studies have shown as of now 3 billion individuals, that's 44% of our world population has been infected with COVID. So at least once. So we know that more and more people are getting it. And yes, there's been a death toll, but we've also overcome, but we also know that we have work to do. As always, as physicians, we are just trying to find solutions to help and prevent a disease, but also find ways to understand it. So now 1 in 5 American adults actually have long COVID. So long COVID, what does that mean? It's more than 3 months of symptoms after initial infection. So that's quite a long time. A lot of people expect to be better in maybe in a couple days, 2 weeks, 4 weeks at most. But when it becomes longer and it's affecting their other systems, if it's respiratory, cardiac, headaches, it becomes this post-COVID syndrome that we're seeing more and more. And that's 1 in 13 adults. And that's quite significant. I know almost some family friend or people in the clinic who've had some type of symptom. And then on the other hand, we do see older adults. So this is kind of nice to see that older adults are less likely to have long COVID than younger adults. And then nearly 3 times as many adults aged 50 to 59 currently have long COVID compared to those who are 80 and older. So despite we seeing through the pandemic, older populations, people who are immune compromised, if they've had heart disease, diabetes, hypertension, they may likely have COVID and complications. We still see that even older populations are getting through the pandemic, specifically if they're 80 and up. So there's something to the secret sauce of them living longer and being able to face the pandemic for those 80 and up. Women are unfortunately more likely than men to have long COVID. So here we are once again, women. We don't like to say COVID or long COVID is discriminating, but it's more of sometimes women have either higher stress or immune compromise, and they are also likely to have autoimmune disease. So there is a pattern that we're seeing more and more. I love this graph because it just shows us a nice timeline of what's happening with COVID when you're infected with SARS-CoV. Initially, you've probably been there where you had a quarantine for 14 days, then 10 days, then 5 days. And it was a point in time where we were seeing how different variants were being transmission or infectious to other populations. Now they've been able to shrink that time period. But really, we've seen symptoms carry on. We've seen it not only going first with the loss of taste and smell or feeling congestion, but also shortness of breath and affecting their other parts of their organs, if it's headaches or having some type of tachycardia or myocarditis or clotting. As you can see, it becomes multifactorial. By the time you're out of the 1 week and 1 and 2, if you're not better after that spike, that means you likely still have this low-grade inflammation that can turn into chronic inflammation. And so that's where you see week 3, week 4, up to 3 months of symptoms. And these can vary from symptom to symptom, even hair loss. So you may have seen some of the headlines saying, oh, hair loss. Is that linked to COVID or differences in my menstrual period or differences in mood and energy? And definitely fatigue is the number one post-COVID symptom. Through long COVID, we've learned many other determinants. Then one of them is not only the need for early screening, early treatment, but also using some form of anticoagulation, which is basically wanting to thin out the blood, because there's mechanisms where we see that the immune complexes in the arteries become very sticky. What does that mean? That just means that more people are likely to have blood clots, or the endothelial layers become inflamed. And that not just means a risk for stroke and heart attacks, which were the scary things we've seen, but also means things as brain fog, having cognitive impairment, people having severe difficulty sleeping. I've had patients who would not be able to sleep maybe just 1 hour in the night, or wake up in the middle of the night because of post-COVID, months out, or when they were exposed to a viral infection, if it was COVID or under stress, their symptoms would arise. Why? Because the chronic stress, the chronic inflammation just compounds on top of each other. And so there's endothelial, I would say, compromise and basically an autoimmune imbalance that affects not only our respiratory system, our nervous system, our digestive system, but even our so more people are likely to have dehydration. Some people are likely to have UTIs, joint pain, muscle pains, and as I mentioned before, sometimes people have this sense of headache or vertigo, and even weakness and body aches. And once again, looking at what happens in the news, we've heard about the spike proteins, the ACE, E2 receptors, what happens at this autoimmune level. And Chef AJ, bear with me, I know this is a lot of science, but this is what we study deeply, because we want to not only solve problems, but we also want to understand, because we still haven't found one single answer or one single treatment for this. So we know that basically, when we have the virus come and impact us at a molecular level, we are having a risk for chronic inflammation, even chronic hypoxia, and then this increases the risk of endothelial damage, as I mentioned before. So let's take a step back. I know that was a lot of science, but the big news, that the biggest bottom line that we have learned is that COVID-19 took advantage of our weakness. Us as a population, we've had weaknesses in terms of our underlying chronic diseases. It was an opportunist infection, which in the viral world of immunology and virology, it's when an infection is able to attack because the immune system is compromised. So we know that, as I mentioned, cancers, people with heart disease, type 2 diabetes, lung disease, but even asthma, even people who might have some dysbiosis or GERD, there is some type of inflammation that is affecting their impact or their interactions with COVID-19. So there's been similar immune dysfunction patterns that have been linked to depression and worse outcomes from COVID-19. So that's what I'm going to be talking about in the middle of the talk. But let's just lay down some common terms. You're going to hear these terms just interplay because they're very similar. A lot of people say long COVID syndrome. The CDC and WHO say post-COVID conditions. And then now the NIH is saying post-acute sequelae of SARS-CoV-2, which is PASC. Now, the CDC has proposed different mechanisms of why we have post-COVID, either through viral persistence, systemic and tissue inflammation, autoimmunity, and microvascular dysfunction. And literally, you can see how everything is potentially affected. We have seen even new viruses come into play in terms of people getting shingles when they have long COVID. They're more likely to get EBV or influenza. That's why there was a second compounding pandemic with the influenza, RSV, and also COVID. And then we are likely to have some type of dysbiosis as well. So here is just kind of an overview of what happens. Once again, the acute signs happen within 4 weeks. The sequelae can happen because there are just disruptive mechanisms in our immune system, our microbiome, or even at the endothelial level. And then long COVID, where we can see it up to 4 to 12 weeks. Unfortunately, in my clinic, I've seen it up to a year of symptoms. I had one patient who actually came to me. This is a story that I'm going to share because he was a father. He played jiu-jitsu, very, very, very active. He tried everything. He was trying to eat healthier. He was trying to even acupuncture and herbs. And a lot of these modalities had some type of support, but not all of them could actually help reduce his symptoms completely. So he came to our clinic and he asked me, why is this all happening? And so I basically went through all these 15 potential symptoms with him. And then Dr. Yu will talk about the potential therapies that we used. So as you can see, 58% of people suffer from fatigue. There's 50 symptoms that you can potentially have. 40% have some type of headache. A lot of people are suffering from loss of taste and smell. That's 23%. 16% have nausea, and people think, nausea is just something that they have to live with. And yes, nausea, you can try medications, you can try, I love mint and other things, but we also have to know that that's a sign of low-grade inflammation. And another thing that we have seen even is hearing loss and tinnitus. So sometimes I have patients going to their doctors and wondering, why do I have ringing in my ears? And I would always ask them, have you ever had COVID? And how did you recover from it? Because most of the time it's because of that post-inflammatory effect from COVID. And then I have a significant population in my practice who suffer from chest pain and palpitation. So we see about 16% of those people tend to have chest discomfort. 19% have cough, and about 21% have this sense of they have to breathe really fast, and then 19% have joint pain. As you can see, there's multiple mechanisms that can be from COVID, and I really think that should be the top question we either ask our doctor is, me having COVID, is that an effect, and what can I do about it? But also being able to understand that COVID is something that is not benign. It's not something that you get and you can always overcome very quickly. There is some work to do afterwards. And it's not just for the elderly or the middle age. We actually see long COVID in children and adolescents. I'm a primary care doctor, and about a quarter of these I would say children are experiencing long COVID. And so I have a teenager, he's a basketball player right now, and he was unable to play for almost a year, and he's tried multiple modalities to help him heal. And sometimes the biggest thing I tell my patients is rest. And I know that's hard to do for all of us who like to move and kind of move on. But oftentimes our body is deprived of rest and sleep, and we need to be able to not always go back to the high intensity exercise, but give it some time to rejuvenate. And Dr. Yu also again will emphasize the lifestyle factors that we can do to help reduce the long COVID symptoms.
So other things that we can get in long haul COVID is mast cell issues. Mast cells are your immune cells are related to allergies and other factors in the body. And there's something called mast cell activation syndrome that long haul COVID can produce. So essentially it's a hyperactivation of your mast cells. So these patients sometimes will have low blood pressure, will have fast heart rates, will be very sensitive and allergic to different things, not only food, but even the fillers of medications. So that can be very, very complicated. They can even be very sensitive to just the cleaning supplies, the pesticides that are used, even a neighbor just smelling it will give issues as well. And this diagnosis is relatively new. This diagnosis is in the past decade or so. So a lot of doctors have not even heard of mast cell activation syndrome, but we do treat that in our office and we do attend conferences on this because it's pretty much it's affecting a lot of people now. Long haul COVID can also be associated with dysautonomia and POTS. So POTS is also known as postural orthostatic tachycardia syndrome. There's a specific criteria to this. So patients, they have very fast heart rates, but the blood pressure doesn't drop. If the blood pressure drops, it's a different issue. It's called orthostatic hypotension. But postural orthostatic tachycardia syndrome and dysautonomia, you have a dysfunction of your autonomic nervous system, and that starts in the brain, and the autonomic nervous system controls the rest of your body, how much saliva you're producing, how fast your heart rate goes up and down. So those are just examples of what the autonomic nervous system can control. And a lot of patients, unfortunately, are suffering from POTS as well as a sequelae of COVID-19. So these patients, sometimes they get misdiagnosed with anxiety when they don't have anxiety. Their anxiety is coming from POTS, and that can cause them to be very sensitive to heat, so they can't tolerate the heat, they can't exercise, they sometimes have insomnia, so it gets very complicated. And unfortunately, some doctors don't recognize it, they don't see it even though it's right in front of them, but we are seeing it more and more in our clinic, and we're always finding treatments for patients. So let's talk about long haul COVID therapies. I want to emphasize there are currently no FDA-approved therapies for long haul COVID. There are multiple clinical trials you can look up, but nothing that's FDA-approved at this time. So as a foundation, I believe that lifestyle medicine is really important to help with long haul COVID, but integrative medicine is also very important as well. So if you've watched Chef AJ's show already, I'm sure you've seen a lot of lifestyle medicine doctors on this show. They talk about healthy eating, which includes a plant-based diet, increasing physical activity, managing stress, having good relationships, and improving sleep, making sure you sleep on time, avoiding risky substance abuse. But sometimes this isn't enough for long haul COVID. So what do we do if it's not enough? Right? So what if lifestyle changes isn't enough? Where do we turn to? Medications, we don't have any medications that can work right now that are FDA approved. So this is where supplements, integrated medication, other modalities come in. So this is where integrated and functional medicine comes in, which we're both trained in. So NAC, N-acetylcysteine, and glutathione are very important. They help with detoxification. They're antioxidants. They help with the liver as well. So NAC and glutathione can help with energy, chronic fatigue syndrome, and some of these long-haul COVID. So some patients have improved with NAC and glutathione. Low-dose naltrexone is a favorite medication of mine. You have to go through a compounding pharmacy for this, so you just can't go to CVS or Walgreens. Your doctor has to go to a compounding pharmacy and make it and tell the pharmacy to make it from scratch. And there are a lot of these pharmacies throughout the US. So low-dose naltrexone, I love it for my autoimmune patients for a lot of conditions as well, not even related to autoimmune disease, but chronic fatigue syndrome, POTS, mast activation syndrome, it can help as well. And it's very low risk. Intermittent fasting can also help with long haul COVID. Vitamin D, you got to make sure it's low. I mean, it's normal or even a higher range. It can help because your vitamin D receptors are in your gut cells and all your immune cells. So you got to make sure that's optimized. omega-3 fatty acids. You can get the plant-based form from algae oil. That's really important for anti-inflammation. Quercetin is really important as well for anti-inflammatory effect, but also for mast cell activation syndrome, it can help as well. Melatonin can have an anti-inflammatory effect and can help with insomnia. Coenzyme Q10 can be very helpful as well. In a lot of long haul COVID patients, their mitochondria is disrupted. And the mitochondria is inside your cell. If you remember from high school and the medical science, your mitochondria is inside your cell, and that's where energy is made. That's where ATP is made. ATP gives you energy to exercise, to walk, to think. And you got to make sure that's optimized. And with a lot of viruses, bacterial infections, tick-borne illnesses, and also long COVID-19, your mitochondria is disrupted. So you got to make sure that's optimized as well.
And I would say I love this list, just so you know, there are, for example, glutathione, NAC. There might be small amounts in it in our plant-based diet. There is some amount, but I would like, for example, broccoli sprouts or Brussels sprouts or broccoli. Those are really the starting points. But for something like post-COVID, that's can be very severe for some people. Is we need higher doses, or we need to measure that out and use it effectively. So my disclaimer in this is don't just take these supplements without consulting your doctor, because there are certain doses that are good and safe. And also to know with quercetin, that's everything in the red family. So that's red tomatoes, red berries, red bell peppers. So that's where we get quercetin. And then melatonin is wonderful. You can get that from tart cherries and pistachios. So obviously we have the whole forms. It's just we need a higher dose to overcome some of these very severe symptoms that some patients may have.
And quercetin is actually in the skin of the apple. So under the onions, under the apples, you can get quercetin. So definitely talk to your doctor. If you go to a conventional doctor, they might not know much of this. So you might have to go to an integrative doctor. And you don't want to take too much, because too much isn't always good. So for mast cell hyperactivation or mast cell activation syndrome, which we talk about in the future lectures, is that antihistamines can help. That's a foundation of the treatment, but there are so many other things that we're going to go over in the future. Dysautonomia and POTS, salt and fluid repletion is really important. Compression stocking as well. That's the foundational treatment, but there are other medications that can help as well, which we'll be talking about. And cognitive behavioral therapy, deep breathing are some of the other integrated treatments that can help as well. And there are so many more treatments out there that are in an integrative field. It can go deep rabbit hole. Some people talk about ozone therapy, some people talk about exosomes, but that's beyond the talk of this lecture today. So we're just talking about the foundational treatment. So definitely find someone in your area or find us virtually or locally as well. We can help you with long haul COVID. Next, we're going to talk depression and COVID-19.
Yeah, and just what Micah was saying earlier, that what he was introducing some newer topics, and we're really, really excited to share the connection that we've shared before, which is the connection between autoimmune, mental health, and even our gut health. But we're going to focus on the overlayer of depression and COVID, because we know that the prevalence has become higher and higher. So the prevalence of depression symptoms in the US was more than threefold higher during the COVID pandemic. And post-COVID definitely is something that we see not just from COVID-19 infection itself, but because of the overlying stress that we've been facing globally. So there's 350 million people worldwide who are affected by depression, either diagnosed or undiagnosed. We see symptoms usually around 20s, but typically in my clinic, because I am very sensitive to what to screen for, is I've seen it as early in elementary, in teenage years, where it affects their learning, their performance, or their energy. Each age group expresses depression differently, and it's contributed to a shortened lifespan. So unfortunately, people who are more depressed are more likely to have other chronic diseases, suffer from diabetes, heart disease, and basically not necessarily, it's not just because they're not seeing their doctors or not taking their medications, but because there is a mental health of chronic neuroinflammation in their brain that leads us to see that there is a connection. And so we know that there's increased rates in the youth. 60% of patients remain untreated or inadequately untreated, and we know that there's much more to understand. This is an interesting study. It's a randomized clinical trial. They were just trying to find treatments for COVID early on, besides oxygen and besides social distancing. And they studied fluvoxamine, and it's just very interesting because they were using this SSRI, which means serotonin reuptake inhibitor, to see if there was, when you increase serotonin, would patients' COVID infection or post-COVID symptoms improve. So they studied 150 adults in the outpatient setting. They had COVID for about 7 days. 0 patients were either treated with I would say there's clinical deterioration in 0 patients treated with fluvoxamine. So actually, patients improved with fluvoxamine compared to placebo in 15 days. So they were just trying to see if that was helpful. And that just shows us that when you put a SSRI, there's a anti-inflammatory effect that's happening at the brain level. So bear with me because it is a very science-driven, deep, I would say, interaction in our brain that happens because of we always hear of leaky gut, but there's also something called the leaky brain. And so that is what we're gonna start to understand. And this is not new. So in the 1990s, there was a relationship between interleukin-6, which is an acute phase protein, and then the function of the hypothalamic pituitary adrenal axis in severe depression. So they were studying this. They were trying to understand why patients had severe depression, but specifically at these axes. They were running labs and they were trying to find out what markers were high. And they found that IL-6, which is a sign of basically inflammation and either acutely or chronically, was elevated in those with severe depression. So as I love this side, connecting biology to psychology, because before, people didn't realize the way you behaved or act or felt, your energy and move was really based at not only the biology level, but the immune system. Now, there are some medications that we have seen to help treat depression, and now there's some medications that help treat COVID. But I would say depressive symptoms does increase with interferon therapy. What does that mean? So patients that Dr. Yu sees, because they have autoimmune disease, they might be on a immune suppressant or some type of immunomodulator. And that basically means when they take these therapies, sometimes their depression symptoms get worse. Other times, they would be given an endotoxin, which is LPS, and that means their symptoms would also either appear or disappear. So there's fluctuations. I would say it's not a one size fits all, but it's also not, when you think of cytokines, it's not one cytokine is the bad cytokine and one is the pro-inflammatory versus the anti-inflammatory cytokine. It's a very complicated process. It's more of the balance versus one is good, one versus one is bad. So anti-inflammatory therapies like TNF-alpha blockers, NSAIDs, for example, ibuprofen, minocycline that treats acne, has also correlated with antidepressive outcomes. So interestingly, when they brought down the inflammation using these therapies, their depression symptoms got better. So as you can see, it's kind of mixed. There are some medications that improve their depressive symptoms and other medications that made it worse. And that was not their intent, but there is a connection that we have to dissect constantly. And so the common themes in psychoneuroimmunology, a term that I keep emphasizing because we know that there's an elevated peripheral systemic inflammation that correlates with the increased risk of depression. We also know that anti-inflammatory therapies may have a role in depression for prevention and treatment. But not all depression is inflammation mediated, meaning just because you have inflammation doesn't mean you're going to get depressed. Sometimes you purely are depressed because of trauma or because you're eating a bunch of processed food, which we see in the research, or you may be in postpartum or in postmenopausal. And so that is there's definitely a bidirectional relationship between our our behaviors, our brain, and our immune system. So our cognition is a reflection of immunity and even how we make decisions. As I mentioned before, sometimes we experience brain fog or more anxiety or depression, and it's literally because our brain is becoming inflamed and some systems are activated and other systems are being suppressed. So the causes of depression are complicated. We know that our brains are constantly evolving. That's why we have something called neuroplasticity and neurogenesis. There are studies that people, even in their later years, even when people think they're demented, there are still some forms of neuroplasticity. So, but what happens is in depression, there's an impairment of this balance. And then also there's alterations and deficits in neurotransmission, there's structural brain changes, there's also vascular dysfunction. So people who've had a concussion or a traumatic brain injury or stroke, they definitely have more symptoms of depression. And those who are hyperstressed, so that's the HPA axis. When I say hyperstressed, just stressed, either low grade, meaning every day they're feeling stressed, or just having a severe stressful event can cause them to be depressed. And then once again, those who with metabolic endocrine dysfunctions, that's why I always check for thyroid levels. I always check for A1C, diabetes, and other hormones, even in women and men, because they may feel depressed, but also their hormones may not be optimized. And then other times people have altered microbiome, if not only because they're eating an unhealthy standard American diet, but also because they are having this altered way of connecting with the stress around them. So their vagus nerve is quiet and their stress nerve, the fight or flight nerve, is hyperactivated. So just a few things. There's a convergent pathways, direct and indirect. I wanted to show this beautiful picture, but it didn't come out here. So I'm just going to have you imagine when you had COVID, sometimes it starts with a sniffle and then you feel congested, a sore throat. But literally, this virus is affecting your cranial nerves. It's affecting not only that congestion, but it's then you start to get the loss of taste and smell. And that is directly involved in your peripheral and central nervous system. That is your brain. So it's the closest thing to your brain. And that's why people have headaches, brain fog, anxiety, depression, and they just feel like they just want to lay in bed for hours. And then later on, we have these peripheral cytokines. So just imagine all these a spider web of systems just getting more inflamed. And these are, supposedly we're supposed to have this strong blood-brain barrier, but there are things that leak through. And usually it's viruses, bacteria, inflammation that leaks through. And those that are responsible, the immune cells, we call them microglia, and I'll explain that later. But I love this slide again because this shows us the immunological pathways linking depression and COVID. We've seen it because of poor diet, sedentary behavior. So those there are studies that those people who exercise more are less likely to have COVID-19 complications, and those who are more stressed are likely to also have more complications with COVID. And as you can see, there are the microglia activation signs that we will talk about here, but also this neurotoxic metabolic serotonin availability. What does that mean? Once again, we see that tryptophan is in the brain. Serotonin is usually in the gut. With tryptophan in the brain, we want to be able to have a balance of what happens. If you have too much inflammation, you're going to get more KYN, which is a pro-inflammatory molecule, or neurotoxic molecule, and quin. So think about it, kin and quin. Those are the bad neurotoxic signals in our brain. And that's what usually are high in those who are depressed and also who are suicidal. And sadly, I've had patients who just felt at the end of the road with post-COVID. And here again, just bigger mechanisms to show what can we do. We know that there's with long haul COVID, there's that cytokine storm, as I was mentioning, all those signals being rising and going through the blood-brain barrier, the ACE2 receptors, and then that stress. And the physical activity here is the lack of physical activity that has this whole mechanism that actually releases the post-COVID symptoms. So there are studies that people are trying SSRIs. I had one patient, she was literally bedbound for 6 months, could not leave the house because of post-COVID. She used to be a caretaker for her mom, but her mother passed away. And so she was just trying to find ways to help improve. And she had everything from heaviness to headache. And she didn't know she was also exhibiting signs of depression. She always thought it was just chest pain and a migraine, but it was actually the SSRI that helped her the most, and of course, a healthy lifestyle. There are new studies that oxytocin can help this pathway, and so I'm excited to see how that can help. Then there's also complementary medicine. I am definitely a fan of using all modalities of healing because right now we don't have it all. It's good to help these people who may feel as if they can't go back to work or engage with their family. So traditional Chinese medicine has qigong, so that's some type of it's kind of like tai chi. They also have herbs, and this helps stimulate the vagus nerve. And once again, there's strong studies that omega-3 and fatty acids and curcumin is great for post-COVID, especially with depression. And that's also a form of Ayurvedic medicine. As I was speaking about before, microglia activation. So that's 50% of our brain is filled with microglia, and these are brain-based macrophages that are responsible for memory. They're responsible for making decisions. They're also responsible for giving us motivation and insights. And when those are compromised, often people feel depressed and anxious. So what does the evidence say? Obviously, it's still very, very new. Diet and depression has only been studied in a few interventional randomized control studies. There's something called the SMILES trial, the Health Med. You can look these up. They've been studying it in young adults. Right now, the overall consensus is that a Mediterranean-style diet or an anti-inflammatory diet, which is fruits, vegetables, beans, nuts, and seeds, can be helpful in the prevention and treatment of depression. And when it comes to our gut health, I love not only omega-3s, but polyphenols. And that's what we're trying to understand, is we're trying to keep finding the connection between the diet and our lifestyle and how we can help heal our post-COVID patients. So here's the sad facts is that we know not only that there's this post-COVID, there's now the financial impact of what's happening in our economy, but food scarcity during the COVID-19 pandemic is really hard for disproportionately our Black population, our Asian, Hispanic, Latino communities. And we know that they have more risk for anxiety and depression. We know that elderly adults have higher risk for COVID-19 complications, but they've actually have developed this sense of resilience. Older people have probably been around during the Great Depression, and they probably heard stories of smallpox from their grandparents. And so they've been able to have more optimistic outlooks for better mental health. As you can see, we always want to look at not only the positive side, but also understand what the realities are of this post-COVID syndrome. We also know that younger age and females have higher rates of depression during COVID-19.
So now we're going to talk about COVID-19 autoimmune diseases. So the big question is, can COVID-19 contribute to autoimmune diseases? And the answer is probably yes. So what do we know so far? We know that many viruses can contribute to many different autoimmune diseases, including the following examples: Epstein-Barr virus, CMV, also known as cytomegalovirus, herpes viruses, and influenza. These are just examples of different viruses that have contributed to autoimmune diseases. There's a mechanism called molecular mimicry, which may be one of the ways that viruses contribute to autoimmune diseases, in that a piece of the virus may look like a piece of tissue in your body, whether that be a joint or a nerve cell. and your immune system will mistake that part of the virus for your part of your body and start attacking your own body. And we've seen examples of this in the past with rheumatic fever, where um, the rheumatic fever, the immune system actually starts attacking the heart. So that's one example. COVID-19 has actually contributed to autoimmune disease. Okay, so here's your answer. So this is a study in 2021. They looked at patients that had COVID-19 and then developed different autoimmune disease. So some patients developed sarcoidosis, which is a very hard to diagnose autoimmune disease that rheumatologists treat. Systemic sclerosis, they saw in one patient in the study. So systemic sclerosis is literally a disease where your skin starts tightening up around your mouth, your fingers, your feet, where there's no more wrinkles, and it gets to so bad that sometimes you can't open your mouth to eat anymore, and it affects a wide range of other organs in the body. Rheumatoid arthritis, myopathy, where it's your muscles are inflamed to the point where you can't even lift your shoulders or walk up the stairs. Vasculitis has been seen as well. Vasculitis is pretty much inflammation of the vessels, and there's like 30, 40 different types of vasculitis out there. It can get very severe. I've seen a lot of patients in the ICU in my training that the first time vasculitis was in the ICU on intubated because it attacked not only your vessels on the skin, but it can attack the vessels of the lungs, the heart, the brain. So it can have many different manifestations as well. Lupus included, it can come out as lupus as well. So COVID-19 is another virus, so it is not surprising that it can do this as well. Is long haul COVID? So we talk about COVID-19. How about long haul COVID? Is long haul COVID an autoimmune disease? It's possible. I personally think it is. Okay. It's a chronic inflammatory condition. We just haven't formally termed an autoimmune disease. Maybe 5 years, 10 years down the road, they'll start calling it an autoimmune disease. But right now, they're still exploring the link between long haul COVID and autoimmune disease at this time. And long haul COVID is a chronic inflammatory condition, and long haul COVID can cause inflammation of the lungs. So some patients of mine have breathing issues. It can affect the brain with brain fog, memory issues. I've seen that a lot in my patients that come to me in my clinic. Neuromuscular issues. Some patients come to me with joint pain. They don't have obvious arthritis or swelling. There's no rheumatoid arthritis. All their labs are negative, but they have stiffness and some joint aches happening. It can affect the heart. I have some patients who have chest pain randomly. And other organs like the kidneys can be affected as well. And how does this happen? We really don't know at this time. We can say it's molecular mimicry, like I've mentioned earlier, but your spike protein from the long haul COVID can be lingering in the body and it's causing immune activation, and it just keeps going and going and causing this chronic inflammation. And unfortunately, there's no, like I said, no FDA approved medications right now, but with an integrated and functional approach to treatment, you can potentially get better. So in conclusion, long haul COVID is an inflammatory condition that includes lingering symptoms called post-COVID. Long haul COVID can have a wide range of symptoms, including chronic fatigue syndrome, dysautonomia, mast cell activation syndrome, amongst other symptoms. Long haul COVID is likely an autoimmune condition that is yet to be officially identified as an autoimmune condition. So there is no one specific doctor right now for long haul COVID. You're gonna go to your primary care doctor first, most likely, and your primary care doctor is gonna send you to a pulmonologist if you have lung issues. They're going to send you to a rheumatologist if you have joint issues. They're going to send you to a cardiologist if you have heart issues. But I have seen patients in my clinic who have seen different specialists, and their specialists are telling them they don't know what to do for you. They send to a GI doctor with abdominal pain, diarrhea. The GI doctor said there's nothing wrong with you, just take a probiotic. Like, I don't think that's going to solve anything, honestly. They've gone to a cardiologist sometimes, and they have dysautonomia and POTS, but the cardiologist doesn't know what to do with them, or the college doesn't want to see them because in the past POTS, they're supposed to be treated by neurologists or cardiologists, but sometimes they don't want to treat them, but they don't know how to treat them, so they end up coming to me and Melissa because we do integrated medicine in this office, so we see a wide range of diseases, and sometimes we're the fifth opinion in this office, and sometimes we're the last solution for these patients, so we're able to be very, very diverse in our treatment options. And long haul COVID is treatable. I want you to know that it is treatable. There is hope. I see a lot of, I'm part of Reddit forums, Facebook forums for long haul COVID, and it's so sad. I see patients there. They've been to so many doctors, and the doctors just say, "There's nothing I can do for you," or "Your labs look great. You look great. There's nothing wrong with you." And I don't think that's the right answer for these patients. There is a way to get better. All right. So if you're looking for a doctor that can treat this, you're probably not going to find it in a conventional MD. Okay. If they do extra reading, they learn more about this, they might be able to help you. But otherwise, you're gonna need an integrative doctor. So you're gonna need to find someone that understands some integrative medicine and functional medicine in your area, or just find us. We're seeing patients nationwide and worldwide. And I think that's the only way to get better at this point. Some patients do get better with time. Time can potentially help you, okay? But if time doesn't help you, lifestyle medicine doesn't help you, then you got to seek out supplements and other modalities. So where do you want to, how do you find us? So in the beginning of this talk, we talked about our social media handles. I just want to reiterate that you can go to our website, drlifestyle.org. We call it Dr. Lifestyle because our foundation is lifestyle medicine. That's why we call it Dr. Lifestyle. Yes, we do functional and integrated medicine, but the foundation is lifestyle medicine, and then we add those other things on. We do advanced integrative testing, lab testing to see what else is causing issues in your body. And just reach out to us, call us, email us. We have a virtual assistant that can help you get scheduled. You can make your own appointment there as well.
That was really a wonderful presentation. Thank you so much. I'm curious, would you just mind answering just a couple of questions?
Yeah, of course.
Okay.
Sure.
Well, I mean, how long is long COVID for most people? Like, is there like a longest case on record so far, or how long do people suffer?
Yeah, that's a great question. I'm sure Melissa will have a different answer because we see different patients in our clinic. But COVID's only been around for what, 2 years or so. So some patients have had long haul COVID for 2 years now. And you can get it. I mean, I've seen patients come after they get COVID, they have this unexplained joint pain, brain fog, fatigue, but we also have seen it sometimes from the vaccine as well. So there are some studies out there with the vaccine. You'll have to look on PubMed with some vasculitis after the vaccine, but a lot of patients with long haul COVID come from the virus basically. So yeah, I mean, 2 years, I think so far. I've seen patients 1.5 years in my clinic.
Yeah, no, that's a great point. I would say on average, I've seen 6 months to a year. That's if they are doing something about it. Sometimes they don't know what to do and they just live on and they get the second COVID virus and then another hit, and so that's more inflammation and it's harder for some. In younger populations, with one of my patients, he said the second time was easier in terms of the infection itself, but the post-COVID was harder. So it's just a different combination of how people are, because it's really based on the point in time too. If they are not necessarily eating right, if their sleeping is out of whack, or if they're extremely stressed and they get infected, then likely the complications are harder. So I always say never try to rush through the infection. Really take your time through the COVID-19 infection and get support early.
I've heard different doctors say that people with autoimmune disease definitely should be vaccinated, and others say they shouldn't. Does it really depend on the individual and their autoimmune condition?
Yeah, that's a great question. There's no right answer to this. The American College of Rheumatology does recommend vaccines, and I'm sure so do the other societies as well. But I've seen patients flare in my clinic after a vaccine. I've seen patients develop new autoimmune disease a week or two after the vaccine. I mean, I can never prove it with labs or anything that it was linked, but timeline wise, it makes sense. So we've seen that stuff in our clinic too.
Have you ever heard of like what Dr. Alan Goldhammer does at the True North Center, where he has done therapeutic water only fasting for people with long haul COVID?
We've heard of intermittent fasting and long COVID, or like if it was 3 days or a couple weeks. But
we haven't done, we haven't seen patients do extended fast in our clinic.
I'm just curious because that if anything, that I mean, I'm sure they're very desperate if they have this to get help. You mentioned something about low dose naltrexone, and I've heard that name, but what is that drug?
Yeah, that's a great question. So, it's one of my favorite medications. So it's a medication that has to be compounded. So it has to be made from scratch from a pharmacy. So naltrexone is a medication that's typically used for opioid withdrawal. So that's a full dose. That's not low dose. This is naltrexone itself. So if you're addicted to Vicodin or these opioids, and your doctor wants to get you off of it and minimize the side effects from the withdrawal symptoms, they'll give you naltrexone. But low dose naltrexone is 10% of the actual full dose, and it's actually anti-inflammatory. It's been used in a lot of different conditions. Your conventional doctor probably will not have heard about this or doesn't believe in it. But we use it a lot in our clinic, and our patients do get better from it. It can be hit or miss. Some patients don't feel any effect from it.
Right. You mentioned exercise improving outcomes. Is that people that exercised before they contracted COVID, or because you're not suggesting an exercise while you have it, or maybe you are?
Yeah, I basically, the study has shown those who already exercise routinely do better. So I suggest exercising before, and light walking is okay during COVID-19 infection or even post-COVID. I never say stop exercising, but I'd say just be careful if it was like more vigorous type of intensive, because there are some patients that need to be cleared by a physician or a physical therapist or a cardiologist before they exercise again.
So can diet help at all once they have long haul COVID? Or I'm imagining there are probably people that have a pretty good diet that are still getting it.
Yeah, I think, food and diet always plays a role. We definitely are, high salt, sugar, and processed foods is not going to help already a chronic inflamed person. To say that it gets, if you go, if you're eating perfectly, it can't necessarily completely remove it, because it's just so complicated. But sometimes people don't even know what healthy eating plant-based is, and that is actually therapeutic. So if you are able to work with your doctor or nutritionist to actually measure out, okay, this is the amount of omega-3, this is the amount of fiber I'm getting, quercetin, turmeric. If you're religious in that and dosing it, then diet can be very, very powerful. And usually people need a lot of assistance or a controlled setting.
Recently I was talking to Clint Pattison, who had rheumatoid arthritis, and he was mentioning for him, like even the smallest amount of oil could send him into a flare. Have you noticed that oil is inflammatory to many of your patients?
Yeah, for some patients, the oil can be inflammatory. I tell my patients, if you're going to opt for oil, extra olive virgin oil is probably the better one out of all of them. But if you want, I always recommend minimizing it in general.
That's
Right.
great. Well, I feel like I was at a medical conference. You could actually probably give that for CEUs. I feel like I think I'm going to go to medical school next time before you guys. Right. Well, thank you so much. I really appreciate you doing a monthly slot on Chef AJ Live and your expertise. And I hope people, if they're suffering from any autoimmune disease, whether it's long haul COVID or not, they would consider having a consultation with one of you.
Yes, thank you so much, Chef AJ.
Oh,
Absolutely. Thank you.
Oh, thank you. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow for the plant-based kitchenista, Chef Kelly Williamson, making a Mexican fiesta.